Hello, everyone, and welcome to another episode of Ask CPS. I'm Cedric Peterson of the Department of Communication, alongside my colleague at the Department of Collective Prevention Services, epidemiologist Dr. Raisa Chonkonfat. Dr. Raisa, very good day to you. Welcome again to the program. I would like to allow you this time to deliver your introductory remarks and let us know exactly who's going to be a part of our panel for today's discussion.
So, good day, everybody. Thank you for tuning in to episode 6 of Ask CPS. On today's episode, we are pleased to welcome our counterparts from the different islands within the Dutch Kingdom, Dr. Izzy Gerstenbloed, Dr. Gerwin Schobbe, and Dr. Koen Hulshoff. From the start of the COVID-19 pandemic, we have seen how the other islands in the Dutch Caribbean have coped with various approaches. So on this episode, we wanted to give you, the public, more information on this topic. We'll be focusing on the similarities and differences between the islands within the Dutch Kingdom, and we hope you enjoy today's show.
Thank you so much, Raisa, for your opening remarks. I'd like to turn my attention now to our invited guests and a part of this episode. Normally, I would take it from protocol perspective, but I think I'll go based on the size of the islands here. So who's bigger, Saba, St. Eustatius? I'm just kidding. Let's start with the island of Saba, and we'll talk to Dr. Koen. Dr. Koen is a doctor of the Public Health Department of, the Public Health doctor in Saba. Dr. Koen, just go ahead and introduce yourself and tell us a little bit about your role there on the island of Saba.
Yeah, thank you very much for the invitation. Dr. Koen Hulshoff in the Public Health Department Saba and from the RIVM. Together with the outbreak management team here in charge of the response against COVID-19.
Thank you so much, Dr. Koen, for your introduction. Let's move on now to the island of St. Eustatius, represented by Dr. Gerwin, doctor of the Public Health Department of Statia. Tell us a bit about your role. Introduce yourself, Dr. Gerwin.
Good afternoon. My name is Gerwin Schobbe. I'm the public health doctor here, the manager of the public health department here on the Eustatius, and directly responsible for the response to the COVID virus pandemic here on St. Eustatius.
Thank you very much, Dr. Gerwin. And of course, our next panelist heads the Department of Epidemiology and Social Science of the Curacao Biomedical and Health Research Institute, Dr. Izzy. Dr. Izzy, a very good day to you. Introduce yourself and let us know about your role in Curacao.
Yes, good day. Thanks very much for this opportunity and for the invite. Actually, a great idea to connect together with Raisa and with our colleagues from Saba and Statia, with Koen and with Gerwin, and to do this together. That's we've never done this before, so that's really good. Thanks very much. I'm the titles you gave me, that's from CBHRI, but I'm also the head of the Epidemiology and Research Unit and the Government of Curacao at the Public Health Department, Ministry of Health. As Koen, I also have work also for the RIVM to assist with communicable disease issues in the Best Islands. And I, in terms of COVID-19 right now, I actually had the response team for within the crisis of COVID for Curacao.
Thank you so much, Dr. Izzy, for your opening remarks. So I want to thank our panelists for being here, a part of the program. It truly is historical. And look at what technology through the pandemic has allowed us to do, is to bring the islands together. So this is definitely a great opportunity. We want to thank you guys for being here once again. Let's get right into our program for today. In this special edition, we want to have invited the islands to basically give some insight in regard to your approach towards dealing with COVID-19 in your respective islands. We want to touch on current epidemiological situation on each of the islands. What is the status of each island when it comes to COVID-19? Let's start with Curacao.
As you know, we've been at this from from the end of January, beginning of February, monitoring what's going on, and it's later on in March where we started getting our first cases in. In the meantime, now we're at 20 positive cases. whilst on weeks at end, you probably may or may not have followed us. We've been, for at least 5 weeks, we were stable on 16, but that's local transmission. And the 20 cases we're reporting now, so there are 4 extra in the last week or week and a half, those are all coming from abroad, are repatriated residents that were stuck elsewhere in Colombia, Santo Domingo, or the Netherlands, or the United States. And they are in full quarantine when they come here. And among those, we have detected these 4 more cases. So they're all import cases. There's still 1 person in the hospital. There are 3 other people that are isolated at home, and 1 regretful fatality. That's the current status in Curacao right now.
Thank you very much, Dr. Izzy. Let's go into the island of Saba. Dr. Koen, what is your current status right now with regard to your handling of the pandemic on the island of Saba?
Yeah, at the moment we're back into containment phase, so we're COVID-free. We got a shock at the beginning of April when we found a cluster of 3 patients, none of which had traveled. So it was community spread, and we still don't know how it got to the island. After that, we went into lockdown, tested over 100 people. Didn't find any more positive cases, fortunately, and all patients recovered well. So yeah, at the moment we're back to COVID-free status.
Okay, thank you very much. And now check in with the island of St. Eustatius, Dr. Hirwing. What is the current status of the COVID-19 situation on the island of Statia?
Yes, we are COVID right now. Statia. At the end of March, we had 2 cases that was import cases, 2 students that came down to do a research here on Statia. They were found positive. Luckily, we had them in the room, and so the whole situation was contained, and we have not had any local transmission going on that.
Okay, thank you very much, Dr. Hirwing. Yes, go ahead. Your last remark.
Well, I think if you look at the numbers, we have not tested plenty. We tested about 22 times, and because the situation was contained, there was not much need to do a lot of testing. So, got to review that.
Okay, thank you very much, Dr. Hirwing, there representing St. Eustatius. Stay with us, folks. You're watching the special edition of Ask CPS. We're going to take our first break, and then we'll get back to asking the questions to the respective islands in regard to how their epidemiological situation is taking place on their respective islands. Stay with us. This is Ask CPS.
El COVID-19 se puede transmitir de persona a persona. Por eso, para mantenerse seguro, hay que conservar una distancia de por lo menos 2 metros o 6 pies de otra persona. No besos, no abrazos y no dar la mano. Este mensaje lo trae el Servicio de Prevención de la Comunidad.
Hi, everyone. Welcome back to Ask CPS. We're here in a special edition in episode 6, talking to the respective islands within the Dutch Kingdom, represented by the island of Curacao, St. Eustatius, and Saba. We have Dr. Izzy, Dr. Koen, and Dr. Hirwing. Stay with us. Next question we wanted to ask the islands in regard to why are these numbers on the respective islands so different when it comes to dealing with COVID-19 in your respective area? Let's start with Dr. Izzy from Curacao.
Yeah, thanks for that. I think that the differences, of course, reflect the different makeup of the islands, our structure, Also the strength of your public health capacity, and also the risk that your a priori risk that you're running for introduction. I think all of us in a mode in the beginning, you're trying to limit or avoid introduction in your country. Of course, that doesn't work if you keep having open airspace and letting people come in. You know it, eventually you're going to introduce it in your island. And once that does happen, you try to contain. You try to keep it, you isolate the cases, you detect them first, you isolate them, you do contact tracing, and you try to avoid as much as possible that you don't spread, that you don't have any transmission on the island. And once you determine that there is local transmission, and then I think all of the islands did more or less the same, is because we work with small numbers. And if you work with small numbers, none of the models we actually have, they work, because you cannot build a robust model on small communities. It's a problem. So, but all models that you can employ will show you in one direction, that as soon as you have local transmission, you might end up very quickly in an exponential curve. That means that the amount of cases will rise very rapidly. And not that we're afraid of the disease in itself. Look, if you look at the disease, and up until now it stays the same, about 80 to 90% of the people who do have the disease have it mildly. So there's a relative smaller percentage that have severe disease. But you are probably a little bit more infectious than it is with influenza. So those, you don't need that many cases on your island to surpass your capacity of healthcare. That's your problem, not so much the COVID itself as a matter of speech. So I think the differences you see, if you look back, and of course hindsight is a beautiful thing, we would always have wished that we have it retrograde, but we don't. So if you would look to Aruba, because their primary source for people coming into the island is mostly from the United States. So if you look back and look at the date of onset when people started getting ill, you only know that after you detected them and you start asking them questions. But if you look at the date of onset, the disease is probably going on for some time. And so there was a relatively bigger gap between start of onset of disease and transmission before drastic measures or measures were taken in terms of closing off the island for import, and after that also lockdown. If you look again in retrospect in Curacao, I think the time lag between detecting a local transmission and taking measures to locking down, that was very rapid. That was there was a very short time lag in between that, and our time lag in closing off the island for the Netherlands was also fairly rapid once we really detected that just about all cases that we had coming. I think it was the first 7 or 8 cases were all coming from the Netherlands and all from the south of the Netherlands. So I think that the response time is an issue. It helps you limit the spread quicker, maybe, or better, or more effectively. But if you look at St. Martin, if I may, but I mean, you have Raisa, so she can tell you better. But you have a couple of handicaps, of course, on St. Martin. You're 2 islands in one. You might have different policies on one island. That's a big handicap, because if it's not geared toward each other, that is an extra problem that you have to deal with. If people live on one side and they work on the other side and nobody's informed about them, that's a problem. If you have a relative big group of undocumented people who are scared maybe to go to the doctor, etc., that's a third problem. So the makeup of your island is important. The structure wherein you work, the fact that you have 2 different governments and 2 different public health departments with not always the most ideal cooperation. All of these things, they play a role in terms of how effective you can be in your response, I think. So I think that maybe reflects a little bit of what you see in differences.
Okay, thank you very much, Dr. Izzy. I want to get a take from the smaller islands now, because clearly the detailed answer we got from Curacao clearly reflects your capabilities of handling this disease. Let's take a look at the island of Saba and St. Eustatius. Dr. Kuhn, your take on this same question. As a small island dealing with COVID-19, how do you see the numbers?
Yeah, as Dr. Izzy already mentioned, it is the risk of incoming virus. It is a numbers game. If you look at the numbers that have come into Aruba, to Curacao, to St. Martin, it's nothing compared to what we have. We are dwarfed, or the other way around, but we get very low numbers compared to them. So your chance of importing a case is much lower. I think that's, of course, one of the main difference between the three big countries and the three smaller ones. But also the visibility of the groups. I think on Aruba, first cases were quite a few people in the hospitality sector. I think they're more visible. You know that tourists are coming in. You know that's where you're looking for them. Whereas maybe on St. Martin, it was a less visible group. Maybe people, family members coming in with the disease. So people who live on St. Martin. Reisa knows this much better, and Dr. Eva as well, of course. But the visibility of the groups make it sometimes harder to find those first few patients, and then it can spread to a bigger number than it would had you found it quicker.
Thank you so much, Dr. Kuhn. Dr. Heerwing, your take on this?
Well, I must concur with Dr. Kuhn and Dr. Izzy. It's for us, it's a number game, and I think for St. Eustatius and probably also Saber, St. Martin, to a certain extent, is also a filter for people coming this way. And I think St. Eustatius was very lucky that we started to quarantine at the moment that we started to. Our catch of the two corona was actually in the first set of people that we started to quarantine. And that was a bit of luck, I should say. But because of that, the cases was well contained. And so there was not much need for us to go to a drastic lockdown, nor were big need for us to test volume people, because we knew where the cases were and what they did, and know exactly who they had been in contact with from the moment they got on the island. Each island is different. Each island have different dynamics, and you can't compare. Each island will have to do what is logic for their situation. Comparing the different islands and how they deal with it is a ludicrous exercise, I would say.
Thank you very much, Dr. Heerwing, and also for the rest of the islands for submitting the answers to that question concerning how the numbers can be seen as different, reflected. We're going to get St. Martin's take once we get back from this break, and also get into how the islands are cooperating with each other, and is there any type of regional response and the strategy that each island took as it relates to dealing with the COVID-19 disease. Stay with us. You're listening and viewing Ask CPS.
Safety tips on how to use your mask. Wear your mask in public places. When removing your mask, properly take your mask off by grabbing the bottom ties of your mask, then the ties at the top, and remove the mask. When disposing the mask, discard the mask in the trash can and do not litter. Safety first. Don't touch your eyes, nose, or mouth until washing your hands thoroughly for 20 seconds. These safety tips are brought to you by Collective Prevention Services and the Department of Communication.
Hello, everyone. Welcome back to Ask CPS. This is our final segment of the program. We want to get into asking the questions to the respective islands as it relates to cooperation between the islands. How are the islands working together in regard to dealing with this pandemic? Let me start with Dr. Kuhn in Saba. What has been the cooperation like?
Yeah, I think the good thing about the cooperative response is that we know each other well. On the 6 islands, we've been working together for years now on outbreak preparedness, outbreak response, together with the RIVM, the Dutch National Institute for Public Health, and the public health departments on the 6 islands. We meet once a month virtually, once a year in person for a few days, in which we exchange best practices. You get to know each other, you know which island has which capacity. And that makes it very easy to quickly pick up the phone and get your strategy ideas from a colleague. Also, during this pandemic, in the beginning, there were daily meetings with RIVM in the 6 islands. We've now gone down to once a week, but we see each other regularly. And then, of course, there are the formal outbreak management teams, Caribbean, Netherlands. The third one just happened late last week on tourism and COVID. And that produces formal advice to the 4 countries, to the ministries of health and the prime ministers. So there's different levels of cooperation in the response to COVID-19 where we work together.
Thank you very much, Dr. Koen. Dr. Izzy, is there an extension to the cooperation within the region that we are experiencing with regard to the respective islands? Can you talk a little bit about that?
Well, very little. I don't have very much to add. I think what Koen rightfully mentioned, the extent of cooperation, and certainly in this crisis, was primarily focused on cooperation within the kingdom. And there's some reporting going on too, let's say for the CARFA. But if I'm very honest, from my perspective from Curacao, we're doing less with that than we are with our direct links within the kingdom.
I want to jump right into the strategy aspect that the islands pretty much executed during this pandemic period and dealing with it. Most islands, of course, carry different measures. To give the audience a better idea of what's going on in the respective islands, can each one of you pretty much give a quick update on regard to the measures that has gone into the lifting and, of course, that are still in place in regard to your respective islands? So let's look at Dr. Izzy in Curacao. What measures have been lifted, of course, as we get on the opposite end of this curve of COVID-19?
Well, like as you know, we did pretty severe stuff, huh? It's the first time. Okay, I'm doing this for 33 years, but it's the first time I had to give an advice of locking down your country, closing borders, and locking down your entire country. So that that decision weighs very heavy. And why? Because you know what it's going to mean for your population. You know people are going to lose their jobs. You know that people are going to get stuck with themselves, with their livelihood, with food, with living. So you don't do these things very easily. And you need to find a balance. The problem is you have a small island. You don't know how the curve is going to go, right? So you want to keep your people safe. And you want to do that in a responsible fashion. So the measures are pretty heavy. And if you trying to answer your question, we more or less got rid of almost everything, except that the borders are still closed, except for the fact that the curfew is still on after 12 at night. So it used to be 9, it became 12. Probably, I hope by the end of this week, the curfew will probably be lifted altogether. The only measure that's in place then is the recommendation of social distancing. Of course, you don't go around playing social police. I don't measure if it's 1 meter and 56 centimeters instead of 2. Or whatever, but you're trying to give people a guideline, and you're trying to also do an appeal on common sense and on your own responsibility. So that's one thing that shifted. And the other thing that shifts is that mass gatherings are still not promoted. Why? Because you know that you're going to introduce people anyway. Even though we have people in quarantine, I don't know of any system that's 100% guaranteed. And if you have mass gatherings, if somebody happens to be a super spreader, as we call it, so somebody who has a high concentration of virus back of his throat, is singing along, is shouting along, then you have an event that you might infect lots of people at the same time. So mass gatherings for now are still not in order. We have quarantine in order for people who were coming in from the exterior, and we're looking at ways how to make that a little bit more palatable. Not very easy, but all right. And still a curfew partially in place. Hopefully by the end of the week, that will be lifted as well. And for the rest, we're almost back to normal.
Thank you, Dr. Izzy. Dr. Kun and Seba, what measures are currently in place, and what are the ones that have been lifted on the island of Seba?
Very similar to Curacao at the moment. So the border restrictions are still there, only essential travel, medical, residents coming back, and they need to be quarantined for 2 weeks. But on the island itself, life has gone back to the new normal, as the hip term is. So normal life, schools are open, restaurants are open, bars are open, but extra hand hygiene, physical distancing. You stay home if you're sick, even if it's a runny nose, you stay home. And those measures will stay in place for a long time. And it's just to make sure that unnoticed patient doesn't cause a big outbreak or a second wave.
And Dr. Herwin, let's get your take on this on the island of St. Eustatius.
At a certain point, we had shut down the schools, and public gathering is still was carried down to very low. I think it was down to 10 people at a certain point. We are now back up to 50, and restaurants are open. Schools have started again, and the connection with the outside border of the primarily of the outside border is still closed. So we have been relaxing the inside measures as much as we can, maintaining, the idea of social distancing and hand hygiene. And so I think life is reasonably to normal back in St. Eustatius at this moment. Only travel is a bit big for that. What I've experienced is that closing is quite easy with all the easiest saying that it's going to cause problems to the economy and those type of things. But I find opening is much more difficult, because when do you open? How do St. Eustatius, when we open to the outside world, is the time that we're probably going to get COVID on the island. So we have to time that on the right, and make sure that when it's on the island that we have it in a controlled way, so that the capacity that we have do not get, and that's a very difficult balancing act to do.
Thank you very much, Dr. Herwin. As we close out the segment, I'd like to ask our epidemiologist, Dr. Raisa Chonkunfa, to deliver her closing remarks. Raisa?
So I would like to thank everyone for joining this evening's episode. I would first like to thank our guests, Dr. Izzy Gersenbloed, Dr. Koen Hulshoff, and Dr. Gerwin Schobbe. We really appreciate you taking the time to be on the show today. And also, of course, I would like to thank our host, Cedric Peterson. So we hope everyone enjoyed this episode, and we look forward to receiving your questions to answer on next week's episode. If the general public has any questions or concerns, please do not hesitate to contact the CPS helpline 914. And you can also send your questions and comments to our mailbox at askcps@stmartingov.org. Have a great day. Please stay safe and united out there.
Thank you so much, Raisa. And of course, to our viewers and listeners, thank you for tuning in and being a part of this episode of Ask CPS. If you've missed the broadcast, be sure to catch the repeat broadcast on St. Martin Gov Radio, 107.9 FM. And for video on demand, be sure to visit the official Facebook page of the Government of St. Martin at facebook.com/SXMGOV. On behalf of all of us here at the Department of Communication and my colleagues at the Department of Collective Prevention Services, I'm Cedric Peterson. Thanks so much for tuning in.